over there to the office of the Cigna Insurance Company World Headquarters. This action is not easy for us. Some of us have never been arrested before. Others of us have been taken part in civil disobedience, but it's been a very long time since we've done it. We've all been part of a growing movement for healthcare reform, but we've become more and more disturbed by the path the debate on healthcare reform has taken. We know that building a political movement requires mobilizing people and marching and chanting. We've done a lot of that. But what we've seen from the opponents of healthcare reform, who are partly financed by large corporate health insurance companies, who are also spending $641,000 a day lobbying against healthcare reform in Washington, is a campaign of deceit, lies, and distortions. Our opponents have not been successful in stopping good healthcare reform legislation, but the charges and countercharges have led us to lose sight of the fundamental moral issue at stake in this debate. The cause for which we are fighting is a moral truth that is as hard and clear as a diamond emerging from a rock of black coal. It's that everyone in America deserves good health care they can afford.
I side with Representative Grayson from Florida. He wasn't afraid to call this what it is, and neither am I. This is the annihilation of America's poor, our underinsured, and our uninsured. And any member of Congress or the Senate that votes against reform is guilty, they're accomplice to murder.
If we're arrested today, it's because Billy Kohler, who had a heart problem and tried to get insurance from Cigna, was denied because he had a pre-existing condition. Dennis Short is going to read his sister's description of Billy's plight.
Hi, my name is Dennis Short, and I'm with the Service Employees International Union of Healthcare in Pennsylvania. Billy Kohler was a great guy with a gentle soul and a loving heart, but that heart didn't always beat so well. When Billy was 39, he had his first heart attack. It was caused by an arrhythmia and made him a candidate for an internal defibrillator. He did what was expected to care for both his heart and his defibrillator. The insurance he had through his employer paid for his care. The company closed and it went and took his insurance. He looked for work with companies that offered health insurance as part of a benefit package, but he couldn't find a job with any of those companies. In December 2007, he collapsed at work and was taken to the hospital. His cardiologist found his defibrillator battery was very low, but refused to treat him as an inpatient because he was uninsured. He began looking for a policy for himself. He called Cigna because he had a dental policy with them at one time. The agent spoke and went over the various policies that Cigna offered about affordability of those policies, but when she heard of his heart condition, she said, quote, "We won't be able to insure you because of that condition." And the phone went dead, and a year later, so did Billy. Why is it that a health insurance company is allowed to decide who lives and who dies? Is that a decision that's made on the basis of who will add to their profits or who will add to their liabilities? We must make it known that they can no longer be the judge and jury of the sick, and they can no longer hand down the death sentences to Americans whose only crime is that they got sick. For too long, we've been coming to these rallies and these meetings, and the story we hear is people dying and losing their homes because of health insurance. We have a window of opportunity to change this, and it's going to close soon if we all don't do what we can. Next year, I want to be at the same rally, the same place, where people are talking about the health insurance they're getting now. They've got a new policy and a new government program that's providing health insurance for everyone. I hope to God this is the last time we ever have a rally like this here in Pennsylvania.
Without real reform, we face a continuing moral catastrophe in this country. Every day in America, 120 people die because they are denied health care by an insurance company. Is that right? Every day in America, thousands of people, most of whom have health insurance, have to declare bankruptcy because of the cost of medical care. Is that right? The healthcare crisis has gone on for decades and has to stop now in 2009. If we are arrested today in front of Cigna, it's because injustice is here. And the injustice that is here is found everywhere else in America, and it's got to stop.
Right.
If we are arrested today, it's because we're determined to bear witness to all who are suffering at the hands of insurance companies, to say that we are no longer going to tolerate practices that violate the moral principles for which most Americans stand. Are you with me on that? Yeah! It's long past time for Congress to act, to heed those principles, and to act. That's why we're here today.
Folks who were arrested today, the youngest person arrested today was Michael Ladson from Radnor, PA. He's 17 years old. He has a brother with a disability who's had problems getting healthcare treatment. We also had an individual, the one woman arrested today was Joan Kozlov. She lost a son in 2006 after he was denied treatment, even though he had healthcare, he was denied healthcare. Okay. Ray Torres from Philadelphia was also arrested today. He is a member of First United Methodist Church of Germantown. Also arrested today was Dennis Short. Dennis Short is with the Service Employees International Union. He is also from Philadelphia. And Mark Steer, the Executive Director of Healthcare for America Now, PA, was also arrested. He is arrested in Philadelphia.